Sleep Cycles
by Diane Moya,
Medina,
Saul Cadena,
and Saadiq Sylvestre. It is heavily believed and proved that a full 8 or 9 hours of sleep could be the beneficial factor between a productive day and a lethargic mindset. The amount of hours of sleep that an individual has could affect many things, including their walk, speech, reflexes, hunger, and a number of many other things that play a role in how well we're able to function and meet the superficial needs of society's everyday influence. These gaps of time that all of us spend asleep are referred to as sleep cycles. A healthy sleep cycle could do wonders for an individual's way of living, positively and or negatively. Everyone has their own personal preferences when it comes to getting the proper rest needed to regain any amount of energy they may have lost while awake venturing throughout the day. Some couldn't function without their full 8 hours of uninterrupted sleep, while others feel fresh and refined with 2 or 3 hours of slumber to help them through the day, accompanied by the occasional cup of coffee, of course. A sleep cycle is simply the cycle of biological activity based on a 4-hour period and influenced by regular variations such as the alternation of night and day.
The researchers were trying to see whether sleep deprivation could temporarily improve patients diagnosed with depression by measuring cortisol levels before, during, and after being sleep deprived. Since depression is linked to abnormalities in the hypothalamic pituitary adrenal axis, a cortisol increase would improve their depression. As seen in this scatter plot, the researchers concluded that cortisol levels do increase after one night of sleep deprivation in people with depression, but these levels go back to how they were at the beginning after the patients have their recovery sleep.
This chart shows the relationship between insomnia and other ailments such as anxiety, depression, hypertension, obesity, diabetes, and congestive heart failure. According to the chart, people with insomnia are more likely to have anxiety or depression. There are many sleep-related disorders, one of which is insomnia. Insomnia is a sleep problem defined as the inability to fall or stay asleep. Psychological factors, substance abuse, the side effects of some drugs, medical conditions such as asthma, inadequate sleep, and a stressful life are the most common causes of insomnia. Recently, the NIH calculated that 50 million to 70 million Americans have sleep-related disorders, nearly 25% of the aged and approximately 10% of the general population suffer from insomnia. In this study, the researchers were trying to find a possible relationship between mouth opening and a specific patient characteristic. Their conclusion was that their dependent group, categorized as non-rapid eye movement, opened their mouths wider during most sleep stages. They also found out that the relationship between rapid eye movement and the amount of mouth opening may be a factor in development of obstructive sleep apnea. In this bar graph, the researchers show the relationship between rapid eye movement and non-rapid eye movement patients' mouth opening in each sleep stage. In all the stages, the non-rapid eye movement patients had a significantly higher amount of mouth opening. The rapid eye movement group is shown as RD and the non-rapid eye movement is shown as ND. The white bar is the RD group and the gray bar is the ND group. In the N1 stage, you can see that the RD group showed mouth openings around 13% of the sleep stages, while the ND group had about 23% of mouth opening during their sleep stage. In the N3 stage, there was very little difference between the RD group and the ND group. The researchers were studying the relationship between sexual orientation and the sleep-wake cycles in men and women. The study concluded that homosexuals slept less than heterosexuals. The article showed how sexual orientation has the suprachiasmatic nucleus, which plays a huge role in the sleep-wake cycle, is larger in homosexuals. This scatter plot shows the relationship between the mean going to sleep time and sexual orientation and gender. Clearly, both male and female homosexuals go to sleep later than heterosexuals. In another graph, it was seen that male and female homosexuals wake up earlier as well, therefore homosexuals of both genders sleep overall less time than heterosexuals.
The researchers were studying the effects of too much oxygen on the sleep cycles and cardiorespiratory events in preterm infants. They were also looking for answers on how the effects of supplemental oxygen affect the sleep cycles in infants with chronic neonatal lung disease. When the supplemental oxygen increased, the rapid eye movements increased while the infants were sleeping.
The chart shows the effect of supplemental oxygen on preterm infants. It shows the difference in the different sleep cycles of the infants and how the sleep actually is. While in the quiet sleep chart, it shows there was a greater increase of the amount of time in quiet sleep. Also, in active sleep chart, it shows there was a decrease in the amount of time of active sleep. In indeterminate sleep and in sleep efficiency, there was no difference observed that happened.
Sleep cycles affect our everyday life. Depending on our behavior when we are sleeping, it can affect the way we act throughout the day. Disease have a big part in our sleep cycle. Insomnia and autism are big factors which disrupts our sleep, which can cause sleep deprivation. Depression is probably the biggest disturbation in sleep cycle. It is surprising to find out that sexual orientation plays a big part of our sleep. It has been found out that homosexuals sleep less than heterosexuals. Another big reason that affects our sleep amount we snore or have a mouth open throughout the stages. Everybody goes to sleep differently and wakes up with different moods. Sleep cycles is an important part of our life. It can affect who we are and what we do throughout the day. Throughout this project, we have found out that there are many factors that affect the sleep cycles. Some factors are very common, from snoring to sleep talking. There are some that we are born with or we develop throughout our lives. Probably the one factor that affects most people is depression. Researchers found many factors that can both help or disturb the sleep cycle. Every factor in our body causes changes in our body from our sexual orientation to our movements in our sleep. Everybody's different, therefore everybody sleeps differently. The more you understand your body, the better you sleep you might get. So have a good night, sleep tight, and remember, don't let the bed bugs bite.